I'm John Archuleta with this Ebola report. A nurse who treated Ebola patients in West Africa has been hastily released by New Jersey Governor Chris Christie after she complained she was being treated like a criminal. The nurse, Casey Hickox, was held in a tent with a porta potty but no shower and given little information. Christie falsely said she was, quote, obviously ill, and Hickox says tested twice negative for Ebola. In contrast, New York Governor Andrew Cuomo said those under quarantine can do so at their homes, where they will be regularly visited by public health officials and can receive guests. Now, this limited quarantine is intended to protect the public from accidental contact with a potential Ebola patient, at minimum inconvenience to the potential patient, although it is at home and it is mandatory. Now, here to talk more about that is UT Biotech reporter Bradley Fikes. Now, Bradley, why is it so hard to get these standards for quarantine?
It's really a case where they're trying to invent things as they go along, and the main issue was you don't want to encounter someone necessarily who's had exposure to Ebola patients without knowing of it. You don't want to have it happen involuntarily. And that's been the main concern. This guy who ultimately developed Ebola, this doctor, was going bowling, took the subway, took a cab, and that's not good practice. And it also means you have to do contact tracing of everyone who came in contact with that doctor. If they're at home, then it's much simpler. No one has to see them unless they want to.
Yeah, now let's talk about them being at home. Do you believe them being at home would be standard for this kind of quarantine?
Well, I hope it's considered, because it makes sense if they're not symptomatic and there's showing no signs of being infected, then do that as a temporary measure. And I hope that these new Ebola tests which have been developed can be used more rapidly to determine whether or not they have the virus, and that will make the quarantine period a lot less lengthy and reduce the uncertainties that we're facing.
Yeah, absolutely. All right. Well, UT Biotech reporter Bradley Fikes, thank you so much for joining us. And you can check out our daily Ebola reports right here on utsandiego.com or on our YouTube channel at UTTV San Diego.